I'd like to welcome everybody to Akron Children's Hospital's presentation, Careers in Healthcare. Today, presenting with us is Anne-Marie Ondo. She is the Talent Selection Specialist for Akron Children's. I am Michelle Merkel, President of Junior Achievement of Mahoning Valley, that is bringing you JA Inspire Virtual today. Anne-Marie is going to give her presentation, and then we will follow up at the end of her presentation with Q&As. So we cannot take live questions, but you'll have to text your questions and answers at the bottom. So at this time, I'd like to present Anne-Marie Ondo.
Thank you. Thanks for having me. I'm excited to be here. So I've been in healthcare my whole career. So there's a lot of different opportunities in healthcare, a lot more than people think about. They think about doctors and nurses when you think of healthcare, but there's a host of other positions that I'm going to talk to you about today. So, okay. So you can get a job in healthcare, like if you wanted to be like a hands-on person, but we also have people that are technical people that don't see patients too. So, and healthcare is in like hospitals, nursing homes, clinics, government, as you know, now with public health, with everything going on. You can do research, college, universities, medical supplies, physician offices, private practices. So it's not just hospitals. So, everybody thinks of the traditional ones like nursing, but we're going to go into some of these other ones. Nursing too is, you can be a staff nurse, but if you're not sure about nursing, I would start out as a nurse assistant or home health to see if that's something you would like to do. The biggest demand we have these days are in medical assisting. So if you're not sure if you want to go to like a 2 or 4 year, you can go to a medical assistant program. And those are the ones when you go to the doctor's offices, they're in the front office. You may be doing the front office, the scheduling, the registration, or you may be doing the back office with the vital signs and helping the physician. So there's a whole list, or LPNs as well, and then you can advance from there. So here again is nurse assistants if you want to try to see if you want to get into patient care. And then LPNs, we use a lot of LPNs now in the physician offices. We kind of use them interchangeably with medical assistants. But if you want to work like in a nursing home, like LPNs are a good area to go into. So again, RNs, there's 2-year programs, there is 3-year programs, and there's 4-year programs. Akron Children's prefers the 4-year program, but there's a number of, you can start out in the 2-year program, and then we have educational assistants to help you with going into a 4-year program. So, and everybody thinks of physicians. So here's a whole list of physicians that you can go into. As you know, Neomed is close, so that's our nearest facility for education for physicians. But you can also look at pharmacy technicians, there's radiology, there's respiratory, there's rehab, physical therapy, occupational therapy, speech, audiology. There's surgical techs. Chofin has that program. We hire paramedics to transport our kids. We have a dental clinic in Akron. We have counseling, social work, the lab. The lab's an excellent field to go into at this time, and we'll go over that in a minute. So radiology, the 2-year program is a radiology tech, but you can also go into ultrasound, nuclear medicine, MRI, different areas of radiology. So as you know, if you've ever broken a bone, you will have an x-ray. So that's what a radiology tech does. And then ultrasound are the ones that use the rays to get an image. They use sound waves. And then MRIs use radio waves. So there's just a whole bunch of different ones to look at. And nuclear medicine too, they use isotopes. Pharmacy, if you like to go into pharmacy, NeoMed has that program too. Pharmacy tech, we use pharmacy techs to help us a lot with compounding and IVs and helping the pharmacist. The laboratory, that's the one that is in the highest demand these days because of COVID. So there, we've like doubled our staff to help, or more than doubled our staff to help with COVID testing at this time. So respiratory is also a good field to go into. There's 2- and 4-year programs. So as you know, they're in high demand these days too with COVID, with treating patients with respiratory illnesses. Physical therapist, if you've ever like hurt yourself and had to, like in sports or just with an injury, if you have to go to physical therapy, they'll help you get back to your normal movement and help you resume your life. Physical therapy assistant helps the physical therapist. They also do treatments, and that's a 2-year program. Occupational therapists, they are the people that help get people back to their daily life. So if they need rehab, they might help them with cooking, cleaning, getting out of the car, getting in the car, getting dressed, those type of things. And then there's a 2-year certified occupational therapy assistant program, which is assists the occupational therapist with the treatment plans. Speech, speech helps a lot with language, but they also help with like feeding, and there's all kinds of different tests that they can help you with to help with your to help you speak. So audiology, again, like to help determine hearing loss. So that's where we've expanded our services in audiology recently for the demand in the Mahoning Valley. There's also like social workers, counselors, dietetics, paramedics. And then if you want to get into the administrative side of things, there's accounting, finance, public relations, IT, HR. So those are the non-clinical areas. But there's also billing and coding, collections, insurance, registration, secretarial, if you're interested in that type of work. And then we also need people, in food service. We need people in housekeeping, maintenance, security, laundry, central supply. So as you can see, we're like kind of like a city in ourselves with all the different areas that we need. You at least need your high school diploma, and then make sure you take math and science classes too. So, and one nice thing about healthcare is there's a lot of growth opportunities. Even if you start out in one area, you can expand to other areas. Excuse me. So make sure you talk to a counselor. make sure, you do your research, and, ways to pay for school. And there's all kinds of resources out there for you. But the few that we look at is My Plan and OWL Group. So in order for you to get started in a career in healthcare, you can volunteer, um, you can job shadow, we have different summer camps for different areas, and you can join, different groups and clubs to get into healthcare. Right now with COVID, the volunteering and the shadowing are kind of on hold, but hopefully next year that'll start up again soon. So healthcare is the type of job that, we're always going to need healthcare, no matter what you do. It's a stable job, it's a well-paying job. You can learn and grow. And the nice thing is with healthcare, you feel like you're making a difference. Even if I'm in human resources and I don't see the patients, I still think I'm making a difference in the lives of the kiddos and the families that we care for by hiring the people that take care of them. So 10 top reasons. So job security. Even with this latest COVID crisis, we did not have any layoffs. It's very interesting work. You can go anywhere, live anywhere. You can we can help you pay for school, and a lot of companies do that too. You can advance, earn a good salary. You can work with people or you can work by yourself, depending on some of the areas. And the main thing is you can make a difference. So that's like one of the top reasons why I've stayed in healthcare my whole career. And that is it.
Wow, lots of great information, Anne-Marie.
Oh, thanks.
So many jobs in the healthcare industry.
I know what you don't think about. Yeah.
Yes, so we're going to leave this time for questions and answers. And again, the Q&A is at the bottom, and you're going to have to text your questions to Anne-Marie, and I will read them to her. But I want to know about your job and what you do every day.
Okay, I'm a recruiter. That's the new title is talent acquisition specialist, but everybody kind of knows the title of recruiter. So I find the best people to hire for the jobs. So I can hire anywhere, any of these jobs that we had listed, from food service to housekeeping to management and everything in between. So my day is reading applications, interviewing. We do behavioral-based interviewing. So we ask questions to get an idea of your past experiences and how you've handled certain situations. We also, for the hard to fill jobs, I try to go out there and find somebody that's not looking. So I use like LinkedIn, we use Facebook, we use Twitter, those jobs or those areas to help us find people as well. And Indeed, of course, we're out there on Indeed, Glassdoor, all the latest social media. So my day consists of talking to applicants pretty much all day and trying to find that best fit for us.
Okay, so we're getting questions in.
Yep. Okay, cool.
And you touched on some good points that I might go back to, but I want to make sure we get these questions answered.
Okay.
So Olivia said, as a recruiter, what do you suggest that someone with no prior working experience to use, and how would it be professional?
Yeah, that's a good question. So make sure you have a resume, but don't put anything personal on there, about your family, about your age, your social security number, things like that. I still get those every once in a while, even in this day and age. So make sure if you don't have work experience, highlight your skills, highlight your education, what classes you've had, what volunteering you may have done, what committees, what associations, anything that you feel that will display your skill set.
Okay. And then she asked, applying for a job with only a minor work permit, how would you go about hiring someone with only a working permit?
A working permit for under 18, we do not hire under 18. So ours, you have to have a high school education and be 18.
Do you have any job shadowing
We do.
opportunities?
Yeah, we do through our volunteer office. Right now, no, because of COVID, but yes, they can call our volunteer office and ask to shadow different areas, and even in Mahoning Valley or Akron.
Okay. I know my daughter is looking at going in a career in healthcare, and one of the requirements was to have some kind of experience at a hospital, whether it's job shadowing. They didn't say specific what it was, but as long as they had some experience. So,
and we have a teen volunteer program, so they can get involved that way.
so this is on a personal, but Keith wants to know, how hard is it for the people working in healthcare that are working with kids that have an illness or a disease?
You know,
So,
it takes a special person to work in healthcare. It is hard because they're kids, you know, and you want to help kids. But we have 3 promises that we want all our employees to adhere to, and they've been around since as long as we've been around, over 100 years. So one is treat each child as if they were your own, treat each child regardless of the ability to pay, and treat each other like you would like to be treated. So we use the golden rule here to, so yeah, sometimes healthcare, you know, pediatrics is tough, but I always say at least we're here, you know, so we're here for people.
and when you were talking earlier about your job and what you do, you talked about behavioral interviewing. So
Right.
does that have to deal with, because you do work with children and sickness and illness, that you want to get the right person?
Yes, because behavioral based interviewing basically shows us what you've done in the past, because past behavior predicts future behavior. So if you give, if we, like, for example, we ask how you would give us an example of how you've worked as a team. So we want to, because that's like one of the biggest areas of healthcare is teamwork. So we want you to give us an example of how you've worked as a team, even in class, like in a lab or an assignment, you know, even that way then we could see how you've handled a situation in the past.
And I think that's very important for those that are on this webinar or that will be watching the webinar later, to stress. I think many of our presenters talked about working together as a team, working on projects. And I think that's important in what we do with Junior Achievement. It's important at Akron Children's and many of the businesses represented today, that they have to work with others and get along with others. Even though
Yes.
you might have differences, you have to figure that out. So I'm glad you touched on that. You also mentioned in as part of the job interviewing process, you mentioned, and I think this is very important, and we didn't touch on this, but the social media sites. You said you go to Facebook and LinkedIn. And so again, are you looking to see what they're posting and kind of
No, we just use them. We don't use it for that purpose.
Okay.
We use it just for recruitment purposes.
Okay.
But that is a good point, because if you become an employee of Akron Children's, you are representing Akron Children's. So, we do have a social media policy in place for current employees to handle themselves professionally, because you are a representative for us.
Okay. Yes, and so that's one thing that we like to touch on too, is the social media. For some employers, they do go to the social media sites to see what they are posting and how professional their pictures are, and their comments.
Now, we would just go to LinkedIn for that professional site, but that's the only one we go to.
Okay, so one of our anonymous attendees said, is Akron Children's, do you have ER doctors?
Yes.
Okay.
Yep, emergency room doctors, yep. And they specialize in pediatrics. So, because, kids are different, even like anything from x-ray to respiratory, to any areas, it's not the same as adults. So you need different levels of, radiation, different areas. So everybody's specialized in pediatrics, including the ER docs.
Okay. And then we have time, I believe, for one more.
Okay.
Oh, so when we talked about the social media, and I brought that up, when you do hire, and they are an employee of Akron Children's Hospital, do you restrict what they can post on their social media?
Well, if it pertains to Akron Children's, yes. So if it's their personal, no. But as I said before, they're a representative of Akron Children. So no matter what, we want them to be professional in all aspects.
And so you don't want them to post information about their patients or.
Right. That's actually that's a violation against HIPAA. Yeah, the law that protects patient confidentiality. So, but I did want to mention too, we are a nicotine-free environment, and most healthcare organizations are. So if you were hired here, you have to pass a drug screen, nicotine test, background check, which includes fingerprinting. We check your education. So there's a number of checks to go through before you can become an employee here.
Oh, very good. Very important to know.
Yep. Very important. Yeah.
You don't get that job right away. You have to pass, a test. And
it takes.
I know many of our hospitals do not allow smoking.
Right. Yep. We're trying to promote health. So yeah.
Yes, makes sense.
Yes.
Well, Anna Marie, I enjoyed your time today.
Thank you. This was fun.
And I want to let everyone know that it is being recorded and will be made available after our live day event. So you can go back to the JA Inspire virtual platform and replay the video. And any additional questions that you have for Akron Children's Hospital, they do have an exhibitor booth. So you can post questions in the chat and access the PowerPoint presentation that Anne Marie shared with us. So at this time, I'm going to end our session, and thank you everyone for your time, and thank you, Anne Marie.
Okay, thank you.